Hi, so we are here at Biohackers World, and I am here with Dr. William Pawluk, and we are going to get into PMF, and you are a holistic physician, so I'm so excited. This is going to be on the Biohackerblondie podcast, and we're going to get into all things health, and you have over 40 years of practice, so you've seen a lot and you specialize in PEMF. So welcome.
Thank
and
you.
Let's get into this. How did you get into this space? And I want to hear your whole journey.
Well, not the whole thing.
The 40 years of journey.
Well, that's actually 50 years of journey. Basically, as a regular family physician, that's where I started my career in medicine doing, is family medicine. And I was actually part of a big medical group, and we grew the biggest family practice medical group on the whole East Coast, US, about 14 family doctors. And we all shared patients. So when we worked on the weekends, we'd go to the hospital and see everybody who was in the hospital at that time. And so in a very short space of time, our group had about 3 admissions to the hospital. People who got admitted into the hospital had to be hospitalized for gastric bleeding. They were bleeding, like GI bleeding. And one of them almost died. And so as a family doctor for many, many years, working with this group and having all kinds of specialists that I work with, I said to myself, I need to do something different for pain management. I couldn't continue this. And this is before the time when everybody got crazy about doing narcotics, because the government actually recommended people not be in pain, and they approved and pushed doctors to do narcotics. And doctors were resistant, and I was resistant. So I said, well, if I can't use narcotics, and I can't use ibuprofen, which is what these people were having problems with, so what am I going to do? So as I thought about it, as I looked around let's say the universe at the time, there was very little acupuncture. Mm-hmm. There was very little supplements, very little alternative medicine, almost none, in fact. So I said, what am I going to do? Well, I remembered acupuncture. So then I decided to do a course in acupuncture through UCLA.
Oh, nice.
And so at that time, there were probably about 300 doctors in the US who were trained in acupuncture. Only 300.
Wow.
And so that was 1990-ish. And when I finished the training, here I go, I'm gung-ho to do acupuncture on my pain patients. And they said, acupuncture, what's that?
Oh my God.
And they said, stay away from me with those needles.
Don't poke me.
Yeah, don't poke me. I mean, the needles hurt. And so I said, okay, fine. So let's find another way to do acupuncture without using needles. And did further research and discovered in the Orient, they had been using magnets on acupuncture points. And of course, I knew that we could do acupuncture point stimulation using heat, moxibustion, we could do pressure, we could do stimulation, we could use light therapies. So the number of tools that are now used to stimulate acupuncture points has expanded significantly over what we were able to do in 1990.
Okay.
So I started acupuncture, couldn't do it. So I said, what do I do now? And started working with magnets. Because they were using magnets on ears, they were using magnets on hands, they were using magnets on acupuncture points. And actually I did a little research study with a friend of mine who did nerve conduction testing.
Oh, nice.
So a physical medicine specialist. So we measured the nerve conduction on an acupuncture meridian using magnets.
Wow.
And we discovered, bang, there's a big difference in the acupuncture stimulation with a magnet. Okay, well, that got my attention. So now we had I had physical evidence of the value. And then so I started working more and more with magnets, discovered all kinds of benefits, but then I discovered limitations of using little magnets on acupuncture points. And so I did more research and started using other kinds of magnetic devices that now became available from Europe. So most of this had been used in Europe extensively for years. And a lot of the research that was published on it was in Russian or Eastern European languages. So we didn't have access to it. And finally, one day I met an MD PhD from the Czech Republic, who got his PhD in electromagnetic field therapy for rehab.
Wow.
And he, for his PhD, had to translate all this science. What normally I do is review the literature, right? He translated it all into his rudimentary English,
You didn't have ChatGPT?
This is a little bit before ChatGPT. How about, 30 years before ChatGPT? So, unfortunately we didn't. So he lent me his manuscript, and I edited the manuscript and produced a new book called Magnetic Therapy in Eastern Europe, a review of 30 years of research. So at that point already, they had 30 years of experience.
Wow, I didn't know that it was...
Right? And that was in 1980.
Yeah, wow.
So now we had science. Now we have research studies on humans and animals and laboratory studies and so on. So here are the mechanisms. Here are the reasons why magnetic fields were working. So that blew the doors wide open for me in terms of magnetic fields. I started working with a lot more devices, did a lot more magnetic field therapy, and eventually, as I learned all kinds of other holistic practices, like hypnosis and IV therapies and healing therapies, laying on our hands, Reiki, things like that. After doing all that, I realized for what I was able to do in my practice, because not everybody in a family medicine practice in 1980, acupuncture. In fact, that's the reason I got into magnetic therapy was because people said, acupuncture, what's that?
I know.
Right? That was back then. So now I was able to use it and explain it to people somewhat in terms of what it was doing in the body and why they should consider using it. So then I started working with German PMF devices that were very low intensity. And they did a decent job. I was getting results and seeing results in people that I wasn't seeing normally or that I was seeing with acupuncture. So this was doing, but I discovered as well that PMF therapy healed the tissue.
Wow.
Acupuncture doesn't heal the tissue.
Yeah.
It works indirectly in the body. And it can help to rebalance things, but doesn't heal the cells directly.
Would you say acupuncture is more for draining like the lymph nodes?
No, it's more than that. It is about, let's say it's about chi. It's about moving energy in the body, to rebalancing the energy patterns in the body. So if you have a kidney infection, then the reason you probably have a kidney infection is that the chi, or the energy in the kidney, was depleted. And then if bacteria happen to hit that kidney at that time, then all of a sudden the kidney gets infected because it can't protect itself.
Yeah.
Right? And so if you increase the energy in the kidney, then the body says, aha, I got you.
And you can do that with acupuncture.
And you can do that with acupuncture.
Okay.
But you can't heal the tissue. You can't heal the cell.
Yeah.
So I had a spider bite. I was going to read a book on my patio, and I looked down my leg. I had an itch on my leg, and I had about a 1/4 inch size lesion on my leg, a swollen area, a bump, red bump. And in the center of it was a little poke hole.
Is it Lyme?
No, it was I said, I've seen enough of these in my medical career. I said, this is a spider bite.
Oh.
Well, typically, if you see a spider bite, you're going to be dealing with it for like 2 to 3 weeks.
Yeah.
You know, whatever you're doing, you compressing and heat and even antibiotic therapy and so on, it's going to take time to heal itself. So I put a big, thick magnet on that area, and I forgot about it. Went and read for about 3 hours, looked down, gone.
What do you mean you put a big magnet?
Well, so let's
I have 2 magnets and you have like the opposite.
Let's say the buttons on your shirt.
Put one here and put one on the back?
Well, let's say the buttons on your shirt.
Yeah.
It was probably about maybe another 25% bigger than that.
Okay.
And thicker.
Okay.
Right. So then I just taped it on.
Oh, you taped it on.
Use a piece of tape, just tape it right onto that spot.
Wow.
Right over that spot. Well, it was a fresh wound.
Do you need both sides of the magnet?
Doesn't matter.
Interesting.
There's a lot of argument about that, and mostly it's not right. I've had arguments with physicists and biologists and neurologists and so on, and nobody, except for the urban legends, say that there's a difference between North Pole and the South Pole.
Yeah.
But there's no good reason for it to be different.
So I guess we're minimal time here. I could go on and probably talk to you for hours. But since we're have about 10, 15 minutes, I want to ask you about the PEMF because you do have the mats and they are on both sides.
So let's go to that.
Okay.
In terms of the evolution, then, as I started working with whole body magnetic systems, and they produced more benefits than I saw typically, and they did at least what acupuncture did.
Yeah.
But now they're doing tissue healing too.
Yeah.
All right, so now I've got the acupuncture type effects and tissue healing. So we started getting more of these whole body systems, started working more extensively with them for all kinds of health conditions. And now I had my book, the Eastern European Research, which again had me think about using them for other things than I would normally have thought of using them for.
Yeah.
Because you still have the medical therapy.
The PEMF is extremely healing for people. I mean, it can help with injuries.
Well, it is and it isn't.
Okay.
It's not the PEMF therapy that's healing. This is a big misconception.
Okay.
And that is that the magnetic field therapy basically stimulating the production of energy in the body. And that's subject to something called Faraday's law. Right? So it's causing the body to make charge. And as the magnetic field pulses into the body, it actually causes charge production in the tissues because of the way the magnetic field interacts with the ions in the body and the electrolytes and the charges on all the molecules. All of this is now amplified in the energy produced.
Okay.
And then the body says, okay, now I got some juice here.
Yeah.
And that's the title of my talk today, God's Own Juice.
I love that.
Right? So this is magnetic physics principles, and now those physics principles are used in the body to heal.
Yeah, and we need energy to heal. We need energy to do everything. And so it's just like, I'm all promoting the mitochondria and providing ourselves energy because I feel like that's also my happiness. Like the more energized I am, the more happy I am.
Both in terms of the cells, in terms of the vascular systems, in terms of the immune system, in terms of the nervous system.
In
terms of the energy and the tissues and in the muscles and so on.
Yeah.
All of that is energized by PEMF therapy.
So when I've done PEMF too, especially with both in front and the back, I can almost feel my organs, kind of moving.
You know why?
So is that the electrons just getting in the ions?
No, it's because the magnetic field is interacting with the nerve cells that control muscles.
Okay.
And the muscles in the belly, inside the abdomen, are in motion. It's not fixed. So everything's moving inside the belly. And the belly itself has more neurons in it than the brain. So you're stimulating the neurons, and you're stimulating the muscles, and you're stimulating general functions, and you're causing increased what we call peristalsis, motion of the muscle, motion of the colon and the bowel in general.
So are you getting things moving as well?
Yes.
Because I feel like my body, things can be stagnant, especially now we're just sitting all the time and not moving. So then, when I'm doing this, I feel like my body is able to move properly.
Totally.
So
the rule of thumb is that magnetic fields make muscles work harder, work longer, and recover faster.
They're exercising them, kind of like when we're working out our muscles. It's like you want to stimulate, have that little bit of stress.
And the gut is especially sensitive to that.
Yeah. So I love this so much. So a lot of people don't know PEMF. A lot of people out there are, what is PEMF? Should I do this PEMF mat, like from Higher Dose or Bond Charge, or the other companies that just have the PEMF mat, which is basically grounding? Is that correct? So is it somewhat just going onto the sand, onto some grass and grounding?
So grass is ancient.
Yeah.
Grounding and earthing are ancient approaches to increasing energy in the body. But essentially what they're doing is they're doing what acupuncture does. If you're wearing a copper bracelet, you're increasing the amount of charge flowing up the acupuncture meridian.
Oh, I love that. I need to have one.
So it's very useful that way, but it's limited.
Yeah.
So most of the research that I've been working with and what I depend on the most is the discovery that magnetic field therapy, you need an optimal magnetic field intensity of about 15 Gauss, 15, and that Gauss is Gauss. That's the intensity of the magnetic field.
And the grounding is less.
5 Gauss.
Yes. Yeah. Okay.
Right? And you need 15 Gauss at the target tissue. So 15 Gauss at the skin, but what do I need across my brain? What do I need across my heart? Or through my lungs? You need a much stronger magnetic field because of the natural loss of energy over distance. And that's a law of physics as well. And the law that I use is called inverse square law. There are others, but the inverse square law is easy to use. And so if you have to deliver a 15 Gauss 4 inches into the body, you need about 2,000 to 3,000 Gauss.
Wow.
And I've got those tables in my book, Supercharge Your Health.
And so that's the strength that you would recommend for most people.
If you're talking to me now, you say that you have a headache or you had a head injury, let's say a TBI, concussion. Mm-hmm. Well, now I know I need to treat across your brain. Mm-hmm. So that's the intensity of the magnetic field I'm going to need for that. But then your head and your brain are attached to the rest of you.
I know. Everything is connected. The more you get into this, you realize the brain, the nose up to the brain, the mouth, the oral, to the gut.
The toe bone is connected to the head bone.
So I think we have about 2 minutes, and I want to ask you so many questions, but how have you seen this help your patients with the PMS?
It's a lifetime. It's not just a short-term treatment. The way I look at it as a holistic physician is it's not just about the moment that you're trying to treat, because you're going to make an investment and you have to get the right piece of equipment for that particular need. But if you're going to get the right piece of equipment for that need, it's going to work for a whole lot of other things too.
Yeah.
Right?
And people have this in their home and they use it all the time because grounding is so essential, and
you have to do it every day.
So divorced from nature that we do need more of this.
We need it every day.
Yeah.
Every single day you age.
Yeah, I know. Right? It's so important, and I feel like a lot of these devices, biohacking devices, are implementing nature because we keep separating ourselves.
We are.
And so that's why we need to add these things.
And you can't build a house without bricks and mortar.
Yeah. We need to lay the foundation.
You need the nutrients. You can't rebuild a bone without having the minerals and the other nutrients necessary to rebuild that bone.
Yeah.
So that has to be there too.
Yeah.
And then magnetic field therapy stimulates all this to work better, faster.
Yeah.
But you still have to have the basics there.
I know. I think a lot of people just want that one thing, and it's really so much connects to it. You know, the deficiencies, the supplements, the real food, the nutrients, and then adding these healing devices in is just
as well accelerates everything.
Here, to optimize your health. So, well, thank you so much for coming on the podcast, and this was so great to take the time out of your day since you're treating everyone so much, 30 minutes, out of your day. So. Thank you so much.
You're very welcome. It's a pleasure.
Yeah.
Unlock your full potential at the Biohackers World Conference and Expo in Los Angeles on March 29th and 30th. Connect with leaders in health optimization, learn the secrets to longevity, boost your performance, and dive into the latest biohacking and wellness innovations. Don't miss out. Tickets are going fast.